I'm Jessica Gall. I'm doing this video for comprehensive health assessment.
My name is Darren Himes. I consent to being in this video.
Okay, Darren. Did you empty your bladder?
Yes.
Okay. If you would just lift your shirt up for me. Thank you. Okay, so I'm just going to start out by inspecting his abdomen, looking at the contour of it. So his is flat to slightly rounded, which is normal. Flat to rounded is normal, but there's no caving in or distension, which is good. Then I'm going to be looking at the symmetry of his abdomen. And I'm just going to shine a light because that helps to highlight any bulges or anything like that. And it looks symmetrical bilaterally. I don't see any visible bulges or masses. Next, I'm going to look at your umbilicus, so your belly button. It's midline and it's inverted. It's not everted. I don't see any discoloration, any cyanosis or redness or signs of inflammation or hernia. Then I'm just going to look at his overall skin on his abdomen. The color is normal for his ethnicity, and I don't see any lesions. I don't see any striae, petechiae, or moles. I'm going to be looking for pulsations or movements. Obviously, I can see your respiratory movements when you breathe. But I don't see any marked peristaltic waves or aortic pulsations. So he's normal with that. And then I'm going to just be looking at the overall demeanor. He is relaxed. He doesn't appear to be in any discomfort or pain. And he's still, but he's not too still. He's not unable to stop moving because he's in too much pain, and he's not trying to hold completely still because he's in any pain. Okay, so I'm going to move on to auscultation now. So I'm going to be listening to your bowel sounds and also to vascular sounds, okay? Seeing if I can hear any bruits, which would indicate turbulent blood flow in your arteries. Okay, so first the bowel sounds. So I'm just listening in all four quadrants. The normal frequency for bowel sounds is 5 to 30 per minute, but I'm not actually counting them. I'm just determining whether they're present, hyperactive, hypoactive, or absent. You can really only say that bowel sounds are absent if you listen for a full 5 minutes and you hear nothing, but his are present. So next to the vascular sounds, like I said, checking for any bruits, which would be abnormal to hear. And since he doesn't have hypertension or anything like that, I don't expect to hear anything. So first I'm going to check the aorta and the renal arteries. And the iliac arteries. And the femoral arteries. Okay, and I don't hear any bruits there. So next I'm just going to move on to percussion. So first I'm going to just assess the general tympany of his abdomen. Okay, so I heard tympany, which is what I should hear since when you're supine, the air kind of rises. So I don't hear any dullness. It's like tympanic tympanic sounds. So next I'm just going to check his liver span or his liver height. This is basically a screening for hepatomegaly. So I'm just going to, in the midclavicular line, okay, and I came to a dull note, so I'm just going to mark that spot on him. Okay, and here's the dull note here. And normal liver height is 6 to 12 centimeters, so I'm going to measure from one end to the other. And his is measuring about 10 1/4, so that's normal, 10 1/4 centimeters for his liver, so he doesn't seem to have hepatomegaly. Okay, so next I'm just going to be percussing for splenic dullness. So this is going to be difficult to see, but on his left side, I'm just going to be percussing from the 9th to 11th rib. And so I heard a dull noise. So now I'm just going to take a deep breath. Okay, and so when he did that, I percussed and I heard a tympanic noise, which is what I should hear because the spleen with inspiration should move. So if his spleen was enlarged, that would have been a dull noise because the spleen still would have been in that spot. So no enlarged spleen. Next, I'm going to just check for costovertebral angle tenderness. So Dan, if you just sit up for me. And I'm just going to be tapping with my fist in your back, okay? Give a simple. Let me know if there's any pain.
Nope.
Okay. So if you had any kidney inflammation, that would be painful. Okay, so since Darren doesn't have any abdominal distension and I don't expect that he has ascites, I wouldn't need to do the fluid wave test on him, but just for demonstration purposes. The way that this is done, just put your hands right in the midline there. Okay, so I'm going to put my hands on either side of him. And so if he had ascites, I'd be able to kind of tap on one side and the fluid would shift over and hit my hand on the other side. But obviously he doesn't have that, so that's not going to happen. But that's how the fluid wave test is done. So now I'm going to move on to palpation. I'm going to start with light palpation just to get a general idea of the area. It might help to bend your knees. Some people are ticklish or this is uncomfortable. Something's digging into them a little bit. So first I'm just going to start really light. Check out the entire abdomen. I'm looking for any muscle guarding, rigidity, large masses, or tenderness. Is there any tenderness?
Nope.
So then I'm going to do the same thing, but go a little deeper. Any tenderness or pain?
No.
Okay, and I don't feel any masses there with the deep palpation. So now I'm going to be palpating for specific organs, starting with the liver. So I'm going to put my hands underneath you, okay? All right. And so in the midclavicular line, just inhale. Exhale. Okay. Inhale, take a nice deep breath. Okay. And so I could actually feel like a firm little ridge at the border of his liver touch my fingers when he inhaled. Some people, like, it's normal to not feel it too, but on him I can. Next I'm going to be palpating for the spleen, which should not be palpable. So I'm just gonna switch over. And this is not, you're not gonna be able to see this, but I have my left hand under his ribs, and I'm kind of in like the anterior mid-axillary line here. Take a nice deep breath. Okay. And I couldn't feel his spleen, which I, like I said, I shouldn't be able to. Next, I'm going to palpate for the kidneys. So I'm going to start with the right one. And take my hand underneath. Okay. Kind of do like a duckbill thing here. Okay, take a nice deep breath. Okay. So sometimes you can feel the right kidney. You can feel it kind of like slide and touch your fingers, the lower pole of the kidney. I couldn't feel his. Now I'm going to do his left kidney. Okay, nice deep breath. Okay. And I wasn't able to feel that. You should never be able to feel the left kidney. So finally, I'm going to just do a couple of the special tests that I would not do on Darren because he doesn't have any of the indications for them. But if he had reported to me that he had abdominal pain, or if I had, found painful areas upon palpation, I would do this. So you just put your, okay. So basically for the Blumberg test or Blumberg sign, rebound tenderness, I would just bring my hand straight down, pushing it slowly into his abdomen, and then releasing suddenly. Was there any pain with that?
No.
Okay. No pain?
Mm-hmm.
Okay. So if he did have pain, that would indicate peritoneal inflammation. Next test, Murphy's sign or inspiratory arrest. So this is very similar to palpating for the liver, because the gallbladder is right there as well. So if you had inflammation of the gallbladder or cholecystitis, this would be very painful, and it would cause the patient to stop mid-inspiration because of the pain, because I'm be pushing on it. So, okay, take a deep breath. Okay, and Darren doesn't have cholecystitis, so he did the full inspiration with no pain. Lastly, the iliopsoas muscle test. So I'm just going to move this sheet. So I'm just going to lift your leg straight up, flexing at the hip, okay? Okay, and then I'm just going to push on the lower third of your thigh. Okay, like hold the leg up. Is that painful at all in this area?
No.
No. Okay. So that would be very painful in someone with appendicitis. So that concludes the abdominal assessment